government body for training doctors and nurses. We are currently looking at working global, and Uganda is one of the countries we're working with. So I'm one of the global health team there. So currently we're setting up with the Department of International Trade to see how best we could go global. We're short of doctors, we're short of nurses, healthcare professionals. So my other role involves making sure the UK NHS is well staffed and we have well-trained doctors and nurses here. So some of the things we're looking at, the challenges, today we've talked about Uganda. Here globally we are shortage even in Uganda. 1 nurse to 20 when I went there, 1 doctor to something like 50, if I'm right, or 700. I saw one psychologist to 700 patients in Butabika. So the ratios are quite scarce. In the UK we complain as well. I think 1 nurse to 4, if I'm right, or 1 nurse to 20 if you're community nursing. So the problems are there. So we are trying to see how best can we support the global way. So we're thinking we can actually partner up with both countries and develop resources as we can. So one of the strategies we're developing at the moment is this overseas placements. We're doing some work in Butabika, also placement in NHS, bringing some doctors here to work and nurses alongside what we're trying to do. Also supporting governments in developing capacity and research to support development of their skills. These are still, sorry, this presentation was for my other presentation to doctors and nurses. So this is around ways we're learning across the globe. We're developing future leaders, skills. So I'm sure there's a lot of nurses and doctors who may be interested in these programs, who want to do placements across. We are in 51 countries currently. So if you work within the UK, you're entitled to go anywhere. Uganda is one of the countries we're working with, just to emphasize. Still the same, just. So I'll talk about Uganda UK Health Alliance, which I lead as part of the team. So it was set up by both UK government and Uganda governments to look at how best they can support development of workforce, health system strengthening, improving all sorts of opportunities of volunteering, ensure value for money from the UK government and also Uganda government, and also to train people in terms of research. So currently, if you focus on mental health, you have 6 NHS trusts and academic institutions. These are the ones which are involved. We're having some of our UK doctors going out, Ugandan doctors coming here. So around all this, including the College of Psychiatry, which I'll talk later. So these are all involved in Uganda. So it shows how the need is for ensuring global health. Brief, those who may not be aware where Uganda is in East Africa, as you can see, surrounded by countries in war, sort of Congo, Sudan, even if you can go down here, Burundi and other countries. So you could see the need for mental health is huge. So that's what that map shows. We estimate around 40 million people. 87 may be living in rural areas. We think around 31% may be struggling with mental health problems. That's what the research shows, which is quite a huge number. The policies are very poor. Currently we're using 1960 Mental Health Act, I think. It's being reviewed at the moment, so she may be better. So 1964, so it's very old. The language is very derogatory. People are being not cared for in the right ways. But we're trying to see how best can we improve ourselves. East London is one of the trusts which is leading on this. Alison is led on the child mental health policy, which has been reviewed currently. It's now almost equivalent to the UK. Alongside that, we need to see how policies are being built as well. So some work is being done in these areas. So East London Butabika link. Currently, I'm co-chair with Dr. Nika Bass, is not here. We started in 2004, funded by the UK government money. What some of our work is around building capacities, going out to Uganda and train doctors, nurses, service users, and also creating dialogue. How can we talk better about mental health around people and creating advocacy? One of our programs, Heart Sounds, is featured on BBC, so around encouraging people to sort of come out, those who struggle about mental health, to come out and talk about what their experience is. So this is what the link is about. Some of our programs, as you could see, we looked at violence reduction on the wards. People with mental health problems often suffer more violence. Looking at child and mental health, Alison leads the work. Psychological therapies. We're looking at some of the work around Ministry of Health, working with the government, engaging the diaspora. I'm sure my colleague Barbara will talk more about that. Also, we're looking at issues around funding. We work with the Tropical Health Education Trust, that's DFID, which offer funding for I think Miss Uganda, she's been given some funding to look at some of our work, through our work. We're looking at our expertise and research, so whoever wants to get involved, they're welcome. Support the refugee camp in the West. Uganda is hosting over 1.3 million people in refugee areas. We're seeing how best can we, in that area when I went up, there's one psychiatrist in Arua area facing 1.3 million people plus the local community, so it's not enough. We're thinking how best can we do some exchanges in that area. Everton Football Club are involved in this program alongside 6 other groups. We're seeing how best can we look at learning from the UK and what can we bring back, because some of us are migrants as well in these areas. So this is a good project which we're currently designing. So we hope to go out in April. We'll do some programs with Everton Football Club. They'll be leading. They've given us some of their footballers to go out. We have to select who's the best. Obviously, Everton is not currently on the top, but we're happy to have a Premier League on there. But as you're aware, people who are refugees have faced all these sort of challenges in terms of torture. Some of them are seeing families being killed, enforced disappearances. We're trying to see how best we can support people in human rights alongside the healthcare visible scars which we have. So the Royal College of Psychiatry, which is not far from here, has been supporting some of our mental health work in terms of training and supporting learning. Also, I think UK healthcare professionals can learn a lot more going out there. So that's why we're working with Health Education England in terms of placements. So we created some placements there in Arua. We'll be going out there to see how best we could support northern Uganda alongside other areas of Uganda, so not only northern Uganda. So this is one of the areas when I went out, we looked at children where most of these children end up in Butabika because they're quite traumatized. The mothers have been killed or fathers, they're victims of war. So we're looking at how best can we keep them there. So sports is one of the things we are promoting. Everton are currently out there training some of the local coaches alongside some of the local football teams, or Bugonzi-BasiimaCrafts Football Club. Red Cross, we're trying to work closely with them and also the government to see how best we could actually support people. Also ensure the local communities don't miss out. So these are all programs. There are many programs you can get involved if you're interested as a Ugandan. Just inform me. So this is this was made for psychiatric trainees representation. But as part of our Uganda UK Alliance, we're very keen to engage with everyone, work with the communities here. I'm happy to support where we can in terms of funding, research, venues, whatever we could do. Feel free to get in touch if you can. Thank you.